Hi, everyone. My name is Dr. William Makis. I'm a Canadian radiologist, oncologist, and cancer researcher. Repurposed drugs. And when I talk about repurposed drugs, I'm talking about drugs like ivermectin, fenbendazole, mebendazole, CBD oil, melatonin, and several others. The COVID-19 vaccines that were rolled out 4 years ago have done a tremendous amount of damage to the population. It's not just the heart attacks, the myocarditis, and people, dying in their sleep and dropping dead on the athletic fields. That's still happening and that still continues. It's not just the blood clots, the strokes, the pulmonary emboli, that's also continuing as well. But now I'm seeing a lot more autoimmune diseases. I'm seeing very complicated neurological injuries, and of course, an absolute tsunami of cancer, turbo cancer. And yes, turbo cancer is absolutely a real phenomenon. It's affecting thousands of people who've had COVID-19 vaccines. And really, a definition of turbo cancer is a cancer that arises in a patient who's had at least one COVID-19 vaccine. I believe it's mainly a phenomenon of the mRNA vaccines, which we know are now contaminated. It may be also a phenomenon of the DNA-based vaccines like AstraZeneca, Johnson & Johnson, and Sputnik, and so on. These cancers, they're a different breed of cancer. They're a completely different phenomenon. They're extremely aggressive. They present at a very late stage, usually stage 4. They're affecting very young people. Cancers that shouldn't affect young people, like breast cancers in their 20s, cholangiocarcinomas in their 20s and 30s, colon cancers. Young people are being affected with cancers that we've simply never seen before. They're extremely aggressive. They metastasize very rapidly, and they have a very poor prognosis. They don't respond to conventional treatments. They don't respond to chemo, immunotherapy, radiation. And so these patients are left without hope. They're being gaslit. They go to their oncologists. They go to these famous cancer centers in the United States, MD Anderson and John Hopkins and Dana-Farber and Memorial Sloan Kettering and all these big centers, Mayo Clinic. I have patients from all of these big cancer centers, and they fail treatment. They don't respond to chemo. And once the oncologists exhaust all their options, the cancer patients are sent home to die. So we need to help these patients. We need to help these patients who are suffering from autoimmune injuries, neurological injuries, and cancers as well. I think this is where repurposed drugs come in. Repurposed.